My name is Tandokazi Moyo. I'm the Business Development Manager at the Technology Innovation Agency. This year, the Technology Innovation Agency, as previous years, is part of the organizers and sponsor of the Bio Convention in South Africa. And as part of the TIA mandate, one of our roles in supporting the development of technology and the exploitation of those, therefore globally, is really to focus and look at sectors that really need support, development, optimization, but also growth and sustainability, which is the core of what innovation is all about. And this year, we're really going to be talking about, we have a dedicated session that is going to look at nuclear medicine. And really the purpose of this session is to try and sit around with different investors, industry, inventors, and discuss and craft strategies of how we can syndicate investments in this lucrative market to sustain this sleeping giant in the bioeconomy sector. So why nuclear medicine specifically this year? So nuclear medicine, as per our focus areas as the Technology Innovation Agency in the bioeconomy sector, it is one of our focus areas, obviously. But secondly, this is a sector which from an innovation perspective, we've realized that it's growing, it's lucrative, and it has the ability to support South Africa in its growth and to deal with the trade deficit. Now, the nuclear medicine sector in 2013 was valued at $11 billion, expected to grow in 2021, which is this current year, to $20 billion. Now, this is not a market we've fully exploited. Our market share in South Africa is relatively, leaves room for us to further grow this market. And obviously, how you grow a market, specifically a technology-based market, is by continuously supporting innovation. So what we've then decided to do, because ourselves as the Technology Innovation Agency have put in money into early stage investments in the nuclear medicine sector. But because it's quite a, expensive sector to say the least, and because of its return on investments have a huge socio-economic impact, we've then said, let's call around, let's talk to other funders in the national system of innovation to say, how do we support and grow this sleeping giant of a sector? Now, over and above calling other funders to sit with us around the table and craft strategies of how we are going to invest and grow this market, we also have called abroad industry leaders, but also inventors and researchers, but over and above that, end users, the market, for all these different parties, the market, the investors, the inventors, the researchers, to sit around the table and say, as South Africa, how do we grow and support this particular industry? Now you will realize when you look around that nuclear medicine is an area that has not been really talked about in the bioeconomy sector, and yet it is one of the most lucrative sectors. And we have evidence of this as a country. We've tested it and it is doing well. The South Africa itself is one of the top ranking producers of nuclear medicine through nuclear technology products called NTP, which is just sitting here in Atteridgeville in Pretoria. It is one of most probably maybe top 5 producers of nuclear medicine, supplying it to first world countries, including the US. And we want to say then, how do we sustain this sleeping giant? Through supporting research and development, product development, and therefore industrialization of this sector. And this session is particularly to say, how do we lift up this sector and leverage on it as part of our mandate as TIA to support and grow, but also to optimize markets and move beyond South Africa, as led by innovation and led by ourselves as thought leaders in the innovation space, which is the key in sustaining, thriving, and upcoming markets. We therefore, as a Technology Innovation Agency, invite you to be part of this session. We invite the different funders in the bioeconomy sector, in the health innovation sector. We invite the different industry players who are currently selling in this particular area to join us in this session. We invite researchers in universities, science councils, research institutions, even globally, to come and join us in this session. We also invite hospitals who have nuclear medicine departments. These are our potential end users and customers. We invite physicians, oncologists to come and join us in this session for all the different parties to really see how they can lift up this sector. This will be a platform for you to engage with different funders, to engage with different industry, but to engage and also to see what are the different high-scaled investments in the nuclear energy sector that we need to support as a country and take forward. I thank you.